Medicare Part D, Medicare's prescription drug benefit. This is what I have to say about Medicare Part D. You need a knife because this is my most important tool when I'm counseling my clients and training independent insurance agents to sell Medicare Part D. You know what I'm talking about if you have already been on a Part D plan. It's extremely confusing, very limiting, changes from year to year. You have to contend with the different formularies. You move from state to state. It gets even worse. Not easy. What I like to remind everybody is just a few years ago, we didn't have Medicare Part D. Number one complaint we got from our clients was that we don't have any drug coverage. So the Medicare Modernization Act gave us a drug benefit. It is limited, but I'd like to remind everybody that something, a little bit of something, is a lot better than nothing. It's not great, it's not fantastic, but it is better than nothing. If you keep that in mind and you're not so negative about it, then you can really appreciate the fact that Medicare Part D does, for most people, help you with your prescription costs. It does cut most of your prescription costs about in half, not all year long. There is a hole to contend with, a donut, and I don't want to go into the whole Medicare Prescription Part D in this short video, but I do want to bring your attention back to the fact that it's not just you. You're not alone in the suffering. We're all feeling it. It's a government program, and it is a bureaucratic nightmare in many respects. But Medicare Part D is better than nothing. It's giving you some help with your drugs, and we all know that the costs of drugs are escalating every year. One thing that people ask me day in and day out is, same with Medicare Advantage, is what's the best plan? And again, there's no best plan for Part D. It's going to vary on your individual drugs, where you live in the country, when you expect to fall in the hole, if you do expect to fall in the hole. Do you get some of your drugs from the VA? Are you one of the lucky clients that are getting all free samples? Is your child a doctor? You know, it really varies from person to person. But there are many, many, many choices. And that's what confuses people, the fact that there's so many different plans to choose from. Most companies offer 2 to 3 plans. And I think it's pretty safe to say that if you took a dart and you just threw it at the wall, that you weren't going to do yourself too much damage. The plans are very similar, much more so this year than they have been in the past, and I expect them to get closer together. So if you don't want to spend hours and hours of research really finding out how this company works, how limited their formulary is, how good their service is, I recommend you work with an independent insurance agent. That's what we specialize in, is training the agents so they can do that research, they can do that legwork, and they can help you make Medicare Part D less painful. You can pull your knife out.